For introduction, I will be presenting on the Jwalkerton water crisis. Water is one of the most important resources for human health and daily life. To ensure water safety, effective water treatment and monitoring systems are required to remove contaminants and harmful microorganisms. However, failures in water management can lead to serious public health consequences. The Jwalkerton water crisis is an example of how contamination of a drinking water supply can affect an entire community. In this presentation, we will discuss the incident, its impact, and the lessons learned from this tragedy. Next is location. The Jwalkerton water crisis community located in Jwalkerton Municipality, Bruce County, southwestern Ontario, Canada. The geographic coordinates of Jwalkerton are 44.1344 degree north and 81.1756 degree west. As shown in this figure, Jwalkerton is surrounded by agricultural land and livestock farms. This agricultural setting played an important role in the contamination incident because animal waste from nearby farms could enter the water source during heavy rainfall.
I will explain the type of list of pollution involved in the Jwalkerton water crisis. The first type is pollution was agriculture pollution. Cattle manure from nearby farm was sprayed on agricultural land, and the manure contained dangerous bacteria such as E. coli 0157, H7, and Campylobacter jejuni. After heavy rainfall, the contaminated runoff into well 5 is supplied drinking water to the town. The second type was microbial pollution. It was the most dangerous contamination because the bacteria entered the municipal water supply and caused several illnesses among residents. More than 2,300 people become sick and 7 people died due to contaminated drinking water. Another important issue was groundwater vulnerability. The groundwater system had fractured bedrock which allowed polluted surface water to quickly enter the groundwater with very little natural filtration. In addition, institutional and operational failures worsened the crisis because chlorination monitoring was inadequate and some water quality records were falsified. And lastly, heavy rainfall acted as a meteorological factor that increased surface runoff and transported contaminants into the groundwater system.
Next, the details of catastrophe and the data of death. The Jwalkerton water crisis occurred in May 2000 in Jwalkerton when the town's drinking water supply became contaminated with E. coli and Campylobacter jejuni. Heavy rainfall caused cattle manure containing harmful bacteria to enter well 5, which supplied water to the community. The contamination spread through the municipal water system, exposing many residents to unsafe drinking water. In terms of casualties, the outbreak resulted in 7 deaths. More than 2,300 residents became ill. Over 100 people were hospitalized and 27 individuals developed hemolytic uremic syndrome, a serious condition that can lead to kidney failure. The group most affected were elderly individuals and children.
I will explain the main impact of the Jwalkerton water crisis. The most significant impact was liquid phase contamination because the municipal drinking water became polluted with harmful bacteria such as E. coli and Campylobacter jejuni. Residents suffer from diarrhea, vomiting, fever, dehydration, and abdominal pain. Some victims also develop hemolytic uremic syndrome, which can lead to kidney failure. Although the crisis was not directly related to gas pollution, agricultural activities produce gas like methane, ammonia, and hydrogen sulfide from manure decomposition. Heavy rainfall and climate variability and indirectly increased contamination risk. The crisis also had impact at different scale. At the local scale, hospitals become overcrowded and families experienced emotional and financial stress. The provincial scale, the incident exposed weakness in water governance, monitoring, and operator training. At the international scale, the Jwalkerton crisis became an important case study in environmental engineering and public health, leading to stronger water safety regulation. I will explain the technical issue and causes of Jwalkerton water crisis. The first major cause was agricultural runoff. Cater manner containing harmful bacteria was spread near well 5 and heavy rainfall carried the contaminants into the groundwater supply. The second issue was inadequate water treatment and chlorination failure. Chlorine residual levels were not monitored properly, allowing contaminated water to enter the distribution system without effective disinfection. Another important cause was systemic and regulatory failure. Government's budget cuts reduced environmental monitoring, inspection and laboratory testing, weakening water safety management. Infrastructure deficiencies also contribute to the crisis because Well 5 was poorly designed and lacked proper protective barrier against contamination. Finally, human error and operational negligence worsened the outbreak. Operators failed to follow proper procedure, falsified record and delay reporting contamination to health authorities.
Next, economic impact. First, healthcare and medical costs. More than 2,300 residents become ill due to contaminated water. Medical treatment, hospitalization and long-term healthcare monitoring result in significant costs. Second, economic loss to local business and community. Local business suffer financial loss while residents spend additional money on water and other necessities. Productivity also declined due to illness. Third, government expenditure and infrastructure upgrade. The government spends substantial fund on emergency response measure, clean water distribution and improvement to water treatment facility. Last but not least, legal and compensation costs. Significant legal expense and compensation payment were incurred to support affected individual and business. Next, solution or action taken. First, immediate emergency response. A boil water advisory was issued and safe drinking water was supplied to residents. Second, public inquiry and regulatory reform. The government introduced stricter regulation and policies to improve drinking water safety and accountability. Third, improvement of water treatment and monitoring system. Water treatment facilities and monitoring system were upgraded to detect and prevent contamination more effectively. Next, source water protection and environmental management. Stronger measures were implemented to protect groundwater source and reduce pollution from agriculture activities. Last, public awareness and long-term prevention strategies. Public education program were introduced to increase awareness of water safety and environmental protection. So, in conclusion, the Jwalkerton water crisis demonstrated the severe impact of poor water management, causing over 2,300 illness and 7 deaths. The incident led to stricter water safety regulation, improved monitoring system, and better source water protection. Overall, it highlights the importance of safe and sustainable water management to protect public health and the environment.